Hello and welcome to Legal Thinking from RWK Goodman. I am Liam Pape and as ever I'm joined by my esteemed colleague Ed Wotton. Ed, how are you this morning?
Not too bad, thanks Liam, but the as ever you are joined will not be for much longer, will it?
No, that's very true because I'm resigning this podcast specifically.
Yeah. Unfortunately Liam will be leaving us shortly, so I mean there's going to be a few episodes where Liam will appear, but this is probably one of the last we'll be recording together, so a farewell to Liam from us all at RWK Goodman.
Thank you very much, that's very sweet of you.
Thank you. Yes,
anyway, what are we discussing in today's episode?
Well, this week is CES Awareness Week, with CES Awareness Day being on Tuesday the 1st of October. So we're obviously talking about cauda equina syndrome and the
impact of the Getting It Right First Time report and the CES pathway, cauda equina syndrome pathway that was installed as a result in the NHS, what impact it's had on people, whether it's working, whether it's being implemented, all that kind of stuff. And we've got some really interesting guests to talk about it. So we've got Claire Thornber, who's the founder of the Cauda Equina Champions charity, Firas Sarhan, who's the clinical education lead at the National Spinal Injuries Centre at Stoke Mandeville Hospital, and our very own Simon Elliman, who's the head of our Medical Negligence department, and he's also a specialist in cauda equina claims.
So without any further ado, let's roll that interview.
So I think the first thing to talk about is the Getting It Right First Time report that was launched in recent years. I'm sure you can give me more detail about exactly when it was, but can we just cover what it is? What is the Getting It Right First Time report? What is the latest CES pathway that's been developed as a result? Maybe I'll put that to Simon first.
Yeah, sure. So the Getting It Right First Time report for spinal services was in 2019. And that report highlighted that some patients with suspected cauda equina syndrome were not being referred for onward care in line with the agreed treatment protocols. And that report also showed that more than 20% of litigation claims for spinal injury related to cauda equina syndrome. So I think that rang quite a lot of alarm bells. And in 2021, the Healthcare Safety Investigation Board recommended a national CES pathway which defined safety critical areas. And that was the pathway which then came into force, as it were, in February 2023. I think it's fair to say, I don't know if you'd agree with this, Claire, that kind of the pathway maybe came in a little bit gradually before that, and some of it was in place before that to some degree. But it was February 2023 when it actually sort of came into force. So what the pathway does is it creates a kind of two-tier system. So dividing CES patients between those who need urgent referral and those who need emergency referral. And if it's kind of just urgent, if I can put it that way, then patients would be referred down a pathway to a community MSK, which is musculoskeletal interface, which is essentially a physiotherapist. Whereas if it's an emergency referral, then you get referred to an emergency department. And some of the other changes which the pathway brought in related to what constitutes an emergency referral. And the pathway states that you only get onto the emergency referral bit of the pathway if your symptoms have been in place for 2 weeks or less. And I won't steal Claire's thunder about that, but I know that she wants to talk about that because, that is a little bit controversial, that period. Essentially, the pathway is aiming to streamline the entire process from someone being suspected of having cauda equina syndrome right through all of the stages of the process where they may ultimately have decompressive surgery in order to relieve their symptoms. What it goes on to do, it makes very key recommendations about the timing of MRI scanning. And the timing of MRI scanning is crucial to the success of the pathway, I think. So it says that MRI scanning should take place within 4 hours of a request being made to radiology. And if the MRI scan is within working hours, it should be reported within 1 hour. And the pathway specifically states that emergency MRI scans for cauda equina syndrome should not be delayed by waiting for discussions with the on-call spinal service, shouldn't be delayed by queuing behind other patients' routine or elective MRI scans, and shouldn't be delayed by waiting for a radiologist to report on the scan. And the pathway makes it very clear that emergency MRI scans for cauda equina syndrome should be taking priority over less urgent scans. Also, surgical teams can review out-of-hours MRI imaging to speed up decision-making. And then I think maybe the final thing to emphasize, in terms of treatment of patients with cauda equina, is the pathway also sets up a recommendation that all patients who still have ongoing symptoms after surgery should be referred for follow-up to the regional spinal cord unit through the online national referral system. So I think Ed does kind of a summary of most of the key things that the pathway recommended, but the extent to which those things have actually been implemented is maybe a bit more of an interesting question.
So how has the report delivered change so far? Who wants to pick that one up?
I can give a little bit of insight into that through sort of patients we speak to on our helpline. Mm-hmm. The pathway indicates that patients with the onset of red flag symptoms within 14 days would be the acute patients that need to be seen to first and MRI scanned. As a charity, we'd like to see that timeframe broadened a little bit, perhaps within 4 weeks. We don't think it's quite wide enough. But moving on from that, with regards to MRI scanning, we're hearing all sorts of different stories. So patients in the pathway, it mentions about bladder scanning before an MRI, that can be helpful to help clinicians make a decision whether a patient's in retention or not, or suspected retention because of cauda equina. And what's happening, we're hearing on the phone lines, is actually the people having bladder scans, they're coming back as not being retaining any urine and they've been discharged in the hospital. But my point is that if they're suspicious enough to warrant a bladder scan, surely they should be having access to that MRI scan as well. And that the bladder scan's only there as an adjunct, it's not there sort of as a discriminator for scanning. So that's a bit worrying. MRI scans, it's very hard to get an MRI scan done at the moment within 4 hours. There's a problem with resources. There's massive problems with radiographers being able to perform the scans. So it's not so much the pathway with regard to MRI scan. I think it's the resources available to people trying to implement the pathway. It's something that obviously needs review along the way and more input, but there's different themes coming out for us. So, for instance, we're having patients in some areas having 3 scans in a week being held up in a district hospital and still not getting to the surgeon until a week later when they're fully blown cauda equina in complete retention, but there's 3 scan positive cauda equina scans sat there waiting. So overall it's a good picture, but there are problems, I think, with people understanding or perhaps still maintain their own pathways, perhaps in their own area. One hospital that stands out really well as a hospital that's doing great things for cauda equina is St George's. We've had several phone calls from patients who said they've been referred from a hospital in the surrounding area and treated and decompressed within 24 hours. So whatever they're doing in St George's, they're doing it really well. On a positive note.
So just to jump in there, it sounds less. It's less that the pathway isn't necessarily being followed where it's in place. It's just that it's not in place everywhere. Is that kind of what you're saying? They're just not taking it on, or is that Firas? Have you got something to put on?
Yeah, I mean, I'm as Claire knows, I'm quite keen in data, and in a recent survey by by a firm, they stated for NHS hospitals and NHS trusts across the UK, and they found that only 20% of NHS hospital implemented that pathway, and 18% are actually partially implemented this pathway, and 62% has not implemented this yet. And this is quite a recent survey, and it's quite an alarming figure in my view. That's possibly need to have more of consideration, more of attention and campaigning of actually taking this pathway forward and to be implemented across all NHS trusts to really protect the cauda equina patients from any further deterioration and complication as a result of delayed admissions and delayed diagnosis into specialized center to support them and to educate them on their conditions. And furthermore, which is alarming to that, is only 40% stated out of these trusts that there is a lack of access to a 24-hour MRI machine as the reason they could not implement the strategy. And I think that's quite alarming.
Wow.
Okay, so it's not everywhere, and obviously that's an issue. But where it is in place, you've kind of mentioned some stuff about the bladder retention. Is that the key issue with the pathway as it stands? Is there any other kind of areas for improvement now it's been in place for a little bit?
I think the pathway as it stands sets a high standard, and I think there needs to be resources made available, and hospitals, obviously, as Firas states, need to get on board with the pathway and trusts. I mean, if everybody isn't on board, how can we sort of get a standard across the country that's a minimum standard of care?
It is very much a resources problem, I think, and something that put that into quite stark focus was in March this year, the Royal College of Emergency Medicine issued a position statement which welcomed the pathway, but they said it couldn't formally endorse the pathway because of the significant issues with MRI scanning resource. So even the Royal College of Emergency Medicine, they're kind of saying, yeah, we want to get behind this pathway. This is clearly the right thing to do. But they felt that they couldn't actually endorse it because the resource, in particular with regard to MRI scanning, it just isn't in place. And the statement went on to say that this leads to an inequity of access to care and also exposes clinicians to claims of clinical negligence. So that's coming from the Royal College. So it does show really that the problem is resources. And I think you probably agree with that, wouldn't you, Claire and Firas?
Yeah, I do agree with resources, but I do think the Royal College of Emergency Medicine could have come on board and tried. You know, there's a bit of politics going on there, I think.
But I think also the one thing you need to remember, I think this pathway has been endorsed by really all of the professional bodies that is really responsible for the treatment and responsible for the diagnosis of individuals with cauda equina syndrome. And I just mentioned a couple of them. Is one of them the Society of British Neurological Surgeons and the British Association of Spine Surgeon. And that really is quite key professional bodies that endorsing such a pathway for its importance. And also for the, I think the long-term savings for NHS, if that such pathway is being fully implemented within their trusts, because that would look at ways of possibly, I would say, negligence or what they call this, medical negligence, etc. I think that would be really reduced a lot within some trusts.
To me, it seems quite short-sighted, and there were 76 stakeholders involved with the pathway, and they worked on that for 12 months, and it was a privilege to be part of that. And to think that there's 60% of them deciding they're not going to take that advice on board from all those eminent people working to help people, it blows my mind, really.
So, Simon, just to come to you for a second, how does this affect recent claims from your point of view?
It's quite interesting because obviously cases that I deal with, there tends to be a little bit of a time lag. So I will probably I'm more likely to be dealing with cases where the actual facts came in before the pathway came in February 2023. But we're definitely seeing some patterns. I do have a current case where the actual alleged negligence was in March 22. So it was just about a year before the pathway officially came into force. But it kind of reinforces some of the relevant issues. So in this case of mine, the claimant had sciatica and was correctly referred to a musculoskeletal interface and saw a physiotherapist. And on the second occasion that he saw a physio, the physio failed to diagnose bilateral sciatica and also failed to diagnose an area of saddle numbness and failed to make an emergency referral. So liability has been omitted in that case on the part of the physiotherapist. And I don't wish in any way sort of start saying that musculoskeletal physiotherapists as a group are not, capable of diagnosing cauda equina syndrome, because obviously they are. But it is kind of an example of how diversion of patients into that side of the pathway, which is kind of the urgent side instead of the emergency side, can lead to missed or delayed diagnosis. And so we have seen, I've seen, that case is kind of one of the clearer examples of that. But we are seeing more cases of clinical negligence against physiotherapists because people are going into that side of the pathway. So I think that's probably the best example I can give from my practice.
Yeah, and Claire, are you seeing that with people at your charity that come to your charity? Is that a similar kind of story that you're hearing?
I think what we're hearing really is the people who perhaps present at A&E who have unilateral or bilateral sciatica and perhaps they're not questioned properly about the cauda equina syndrome at the time, or they're dismissed and referred back. A lot of those people are presenting back to hospital with 24 to 36 hours and developing full-blown cauda equina syndrome. And there again, it's a gamble with the outcome, the resources, people, what's available to them to get the surgery they need at that time. But that person was in the hospital ready to be scanned 48 hours earlier. So it's the same old story, isn't it? We're still seeing a lot of that going on. It's at what point do you actually accept that there's enough red flags there to warrant that scan and surgery? It doesn't. You can't fix cauda equina syndrome into the most acute set of symptoms. There has to be flexibility for that onset of the symptoms, I think, for the best patient outcomes. It can't be rigid.
And just to expand on that a little bit more, what impact does this have on people who experience CES?
I was talking to this about somebody in the office to somebody in the office today, and really we speak to people and they're like a rabbit in headlights when they come out of hospital. They still don't know where to go for help and what to do and what in fact is what they're dealing with. We did a survey with Firas, and I think less than 5% of people are actually told by the hospital or a clinical appointment what cauda equina syndrome is and what that means to them. So that means the vast majority are just leaving hospital without the tools or knowledge to help themselves. What does that mean for somebody? It means that they're leaving hospital without the support they need. They've got massive problems of incontinence, sexual dysfunction, pain, mobility, financial issues with jobs, work, relationships, and a lot of them are struggling alone, unsupported. So that's got massive impact on the mental health. So it's a disaster really, and it's up to us as a charity to try and catch that patient group. But we need to get the NHS on board with us helping to support people. So I think things are improving very slowly in pre-surgery areas, with getting perhaps more people to surgery earlier than was happening before in those hospitals that are doing a good job. But ultimately, post-op is still the same, and there's still a terrible gap there for cauda equina patients.
And Firas and Simon, is that kind of the same thing that you're seeing as well in terms of the impact that it has on people? This kind of,
I think I could add to Claire's. I think one of the key issues should be on really need to be is to prevent complication development following the actual diagnosis of someone with cauda equina syndrome, because once the individuals start developing complication, their care pathways become complex and their needs and demands from the health service will actually increase rapidly. and really early diagnosis that will prevent complication development, will mean a smooth journey of rehabilitation for that individual. And again, cauda equina syndrome is not just only numbers. These actually individuals who have families, or who's a beginning of starting a family, or having a job, or having a work that they want to go back to, and therefore the having a clear diagnosis of the clear pathway of rehabilitation is really an essential, and it's really a must for these individuals, because all deserve a life, deserve a quality added to this life that will allow them to function normally within their society or within their community.
Yes, and Simon, is that the same thing again?
I totally agree. I mean, I think the effect of the pathway not working as effectively as it should, not being adopted by, as Firas said, about 60% of trusts, is that the end result of that is some patients are still not being operated on quickly enough. And the result of that is poorer outcomes for patients. Sometimes patients who could have made full recoveries being left with distressing lifelong symptoms. So that's the outcome. That's the outcome we're seeing of trusts not implementing this. And I guess also to some extent the lack of resource that's being provided centrally to overcome some of these problems.
And I think, talking about the lack of resource, something that's come back to mind is over the Easter break, the Easter bank holiday, I spoke to two different people from Gobowen and Wales and Hereford, and they developed cauda equina syndrome, but that bank holiday weekend there wasn't a surgeon in the region who was able to operate. So they were delayed significantly and actually had to be transferred over to Birmingham for surgery. So there is a real problem of lack of resources, and I sometimes ask myself, would you ever be able to implement the pathway nationally for it to work? Is there enough resources there to back it up?
And kind of to round off the discussion, what support is out there for people who do suffer long-term disability as a result of delayed treatment of CES?
Well, as a charity, we obviously try to offer as much support as we can. So we're very much focusing on mental health services, clinical psychology, psychosexual psychology, CBT, community events, getting people together so they don't feel isolated or that they're the only person who has cauda equina syndrome. We're working with Firas to develop respite stays for family members, and we've got online family therapy sessions, and ultimately it's our vision to sort of create a national centre of excellence for cauda equina syndrome rehabilitation. And we're really grateful for Firas coming on board with us, helping us to try and work to achieve that goal. So if you're a cauda equina syndrome patient and you want support, I think get in touch with us and we'll try our very best to do everything we can to help.
And I think I'd like to add to that. I mean, I think our ultimate goal as healthcare professionals is really to have a safe discharge for all of our patients in their own communities, and ensuring that there is adequate support, whether that through their GP or through their community care providers, whether this is from NHS or private, as well as really having access to the third parties, which is that charities, and in that case would be the cauda equina champion, really for them to seek the right information and the sort of most up-to-date information, really to support them within the community or within their home environment. I think this is quite essential, and that should really be the campaign of the champion charity for cauda equina, is really to encourage all trusts to actually be part of that pathway, and to for the NHS itself to provide enough financial resources to allow that all patients suspected with cauda equina to have their MRI within the first 24 hours of them being seen by a specialist within the trust.
Okay, thanks for that. And are there kind of any other ways of accessing support, perhaps in the community, that you might be aware of or that are in development right now?
Yes, the Cauda Equina Champion charity is really in the process of developing an app, and that app really is to provide the patient relatives and professionals with necessary and essential information for them about managing patient with cauda equina, and also for the patient relatives, how to actually manage themselves within the home environment and how they can sort of access and understand their condition in a much better way. That will help them and support them, possibly early identify if there is any complications might be developed as a result of their condition. And again, this is really part of the GRIFT pathway is really to involve in training and development and education, and hence why we're having a section within our app for professionals, really for us to bring them the resources to actually allow them to have possibly correct diagnosis of the patients and support them with the latest research and work that's been done within the area. I think also it's essential for the patient to be able to record and document some of the signs and symptoms they're actually having while they're experiencing cauda equina or diagnosis and so on, so they can share this information with their GB or with their medical staff or with their professionals to really allow early diagnosis and smooth diagnosis of actual patients. And again, as we all know that since COVID hit us, there's more and more reliant on technology and innovative way of actually accessing information. And we've done recently a survey. We surveyed about 379 patients or individuals with cauda equina, and the majority said that they heavily rely on the internet. And we all know about the information on the internet. Some of it is not really valid and not reliable, and that by itself could cause more confusion to the individual and their relatives. And hence we want to deliver and develop this app to actually provide them with the correct information that could help them and really could actually enhance their understanding and therefore to have informed patient and individual about their condition for them to access the appropriate healthcare needs and to access the care packages that they might be required.
I think it's very important. I think it'll be groundbreaking really for cauda equina patients. They'll be empowered, they'll have the knowledge at their fingertips, they'll have a lot more confidence when dealing with healthcare professionals, and ultimately the education about the condition will just go a long way to make their lives a lot better. So it's a really exciting project, and hopefully we're looking towards before Christmas, aren't we, Firas, to launch the app?
Definitely, and I think also we've done also another survey. Is really looking at what sort of areas and you need to be covered within the app itself, and really quite essential to look at the thing that they want to know. For example, they want to know the anatomy and physiology of the body and the spine and the nervous system and how it actually works. Looking at the nervous system itself, looking at the vertebral spine and the musculoskeletal system and other issues that linked and associated with cauda equina, like renal function, digestive system, reproductive system, skin following cauda equina. I think these are quite essential problems that they actually want to know and they want to seek for in order for them to have correct information. And adding to that also, they want to learn more about their skin, their bladder, their bowel, their sexuality, and also about the motor and sensory function post cauda equina. And again, this is really shows that we are dealing with a quite a hungry group of individuals who wanting to know more information about their condition and sort of to take it from really the reliable resources that could really give them confirmation with confidence.
Okay, thanks everyone, and thank you very much for your time.
Thank you.
Thank you.
Thank you for listening to Legal Thinking, and thank you to our guests for joining us on today's podcast. If you want to find out more about the topic that was discussed today, make sure to have a look in the show notes where we'll have linked everything up.
And And you can find all of the back episodes of Legal Thinking in your podcast provider of choice, and you can also subscribe and follow us on there too. And as always, make sure you leave us a 5-star review on a podcast provider of choice, as that helps other people find us. Thank you very much for listening, and we'll see you next time.
Thanks for listening.